I'm here with Dr. Bradley Foster in Chico, California. Bradley, how are you today?
Doing really well, thank you.
If you could tell a little bit about what you do and how you got to where you are, that'd be a great place to start.
Okay, absolutely. So I've been a chiropractor for 18 years. I'm in Chico, California. The campfire just came through my hometown of Paradise and up to Chico 4.5 months ago. So we're dealing with the aftermath of that, and the fire taught me an awful lot as far as how we process pain, how we process grief. One of the things that I created starting 3 years ago was it's an online company called SpinalAxis, where I teach people about how to access their alignment. One of the things in the creation of this is I was running up against some pretty severe ADHD. And I was medicated with pharmaceutical pills. They would give me Adderall or Focalin or anything like this. And the Focalin would help me focus, or the Adderall would help me focus, but in many cases I would have anxiety, which these medications did nothing for. In fact, they would make the problem much worse because now I was focusing on anxiety. And I came up with this, as they were starting to legalize CBD, well, let's start experimenting with some of the CBD. So we had stuff flown in from the UK, and we had like tinctures and pastes and all kinds of different concoctions. And so we were dealing with potencies, and we were dealing with delivery systems. And I tell you what, there was nothing that changed my ability to concentrate and focus like the day I discovered CBD and started to incorporate that into my life and into my practice.
So you found that it works for you. How does it benefit your patients, or what have they said?
It's very interesting because I see it as something that helps me focus. It can take my ADHD and from my mind spinning up in here, it can really ground me and center me in my core and in my center. And so I would recommend it to a patient and suggest that they start taking a certain tincture and a certain dosage for such issue. Maybe it was pain, it was swelling, it was inflammation. And they'd come back in and say, the dangest thing, it's helping me with my hot flashes. And I never had recommended it for hot flashes, but I was seeing it have a very positive effect for hot flashes. Autoimmune conditions. I believe that the body can get to a point healthy enough to where the body is going to start taking care of itself and healing itself in a way. And CBD is that extra foot on the accelerator to help the body's own desire to heal itself, its own capacity to heal itself. And so when the body and the mind are working together, when the body and mind are in alignment with each other, the CBD is so potent at helping people heal. So I can't say that there's this one thing that I would prescribe it for. I could recommend it for, but I'd recommend if people are having issues sleeping, take some CBD oil and see what they can get out of it. And not only were they sleeping better, but they were waking up the next morning with less or no pain.
Right. I mean, I've heard the same things. That's great to be able to incorporate it into your practice. So can you tell the audience a little bit now about how the online program works, how you can serve more people outside of your office with your online programs?
Well, it's maybe the worst business model I've ever heard of, because I'm like the dentist that invented the toothbrush. And I'm sure the whole dental profession at the time thought, oh my gosh, we're going to lose all of our patients. They're never going to come back. But I'm saying that nobody can help, or nobody can heal, or nobody can cure somebody the way that somebody can cure, heal, or fix themselves. So my whole concept is the ability to engage the shoulder blades will make it impossible to have bad form. And so if I spend time with a patient, that's me being one-on-one with the patient, that is my leverage, one-to-one. And then when that patient with chronic pain now heals themselves, they're not coming back in because they don't have chronic pain anymore. So I need to go out into the marketplace. I went out into the corporate workspace and I started setting up demonstrations, and I'd go into a company and I'd say, show me what you guys are spending on work comp insurance, on disability, on just the amount that it would cost a company with the disability and with work comp injuries mounting up. What it was able to do for a corporation, for an increase in morale and increase in teamwork and purpose. When your shoulder blades are engaged, try this out. If you engage your shoulder blades, it's impossible to have your head and neck in a position they shouldn't be in. Hands, chest, shoulders, wrists, they are open, and low back and hips are entirely wide open, and it's impossible.
Yeah, I'm starting to stand differently now because you're talking about that.
it keeps that hinge open. So when the hinge is open, it's impossible for the low back to be in a position it shouldn't be in. So discs start to heal themselves, pelvic floor issues, tailbone issues, shoulders, neck, migraine issues, they go away. So I wanted to put a system together, which I called SpinalAxis. And SpinalAxis started out as a series of stretches. People love the stretches, they do them every day, and they'd get better. And so then I created an online portal, SpinalAxis.com. They could go to the portal, they could learn the exercises, and it was just a depot where they could go to watch videos. And like I was saying earlier, from the campfire, I've had the majority of my patients disbanded and scattered across the US. And so the lifeline to this methodology is the online portal. And we're realizing that despite whether you're a firefighter that was dealing with that fire up there, whether you're a patient that's been they lost everything in the fire, if they wake up every morning and they do these exercises that they find on the portal, that it's more than stretches and it's more than a online depot to watch videos. It is how people are accessing their alignment, and they are overcoming issues that we've never been able to help them overcome in the clinical setting. So the online portal is an ability to reach many more people than just one at a time, or me going into a corporation where I can speak to 30 to 50 people at a time. So to have an online audience is absolutely awesome.
And is that a subscription-based model then? So is it on demand, or how do you access it?
So the way we have it set up right now is we have coupon codes. So if anybody wanted a coupon to get a discount, it's normally $250, and that will get 90 days of access. And I can't tell you if you're going to get more value out of the first 90 days. After 90 days, it goes to like $49 a month, and I'm doing weekly webinars and live trainings on the portal where we can start talking about how to get, like, say, more of a black belt. How do you get to be more of a black belt in this technique? If you're trying to rip up your shoulder, your low back, I show the little nuances that really take your treatment for your neck and your shoulder and your low back to the next level. So again, do you get more value out of the first 90 days or in the continuation of going through the continued training and support?
Okay, well, that's great. So you've got a subscription model, you've got online training, you've got live webinars to help people, and you can really spread your word by using this portal. So everyone, I encourage you to get onto Dr. Bradley's website, check it out. What's your email in case they want to get a hold of you?
drfoster@spinalaxis.com.
Okay, great. Well, I appreciate your time, and keep taking care of patients. Have a great day.
Absolutely. Thank you so much. Have a great day.
All right. Thank you.
Yep.